Hey everyone, it's me, Dr. Whimsy, your favorite naturopathic doctor, answering questions you may have about how to stay healthy. And hopefully we can do it in a sane and simple way that's not going to be too expensive, and pretty much anybody can follow any of the suggestions that I make here on my channel. The best news is that it won't conflict with anything that your doctors are already recommending, and it can be incorporated into a daily healthy habits. So today I'm talking about exhaustion. Americans are exhausted. One of the reasons why a lot of people come to see me in my offices is because of exhaustion. And in fact, I would say that exhaustion, being tired, is one of the main reasons people come to see a naturopathic doctor. But I want to know why you're exhausted. Before we go and give you a bunch of supplements and you end up spending a lot of money popping various different pills and tinctures, let's start by understanding that exhaustion is a symptom, it's not a diagnosis. So I have a list of just 7 things off the top of my head that I think about when I have a patient in my office who is suffering from exhaustion. And this is not an exhaustive list. Speaking of exhaustion, this is just 7 things. There's there's more than 7 things, but this is the main 7 that I could think of. Number 1, the number 1 reason that you might be exhausted: sleep. You're not getting adequate amounts of sleep. So when we talk about adequate amounts of sleep, we're not talking about the person that goes to bed at 11 p.m. and gets up at 7. That would be 8 hours, that's true, but we have to also take into consideration that you may not be able to sleep through the night. So you're getting to bed at 11, but if you're tossing and turning, if you're getting up frequently, then we can't say that that's a person who got 8 hours. But we really want to make sure if somebody is exhausted and they're not getting adequate sleep, that we can improve sleep quality. Reducing caffeine, sometimes 8 hours prior to bed, not drinking alcohol prior to bed, and maybe just getting into bed half an hour early. Little tiny things like that can help. Meditation prior to sleeping, if it's stress related, all those things can help. Check out your mattress, make sure that your mattress is comfortable. Sometimes changing a mattress can improve sleep. Making sure your pets, your cat, etc., is outside the room. I stand accused. My cat is often the first being to wake me up. Those are all things that can interrupt sleep. So if we're talking about helping a person who suffers from exhaustion, I cannot stress enough the importance of good quality sleep. And that means taking sleep seriously, because sleep is one of the ways that our body helps repair itself. Number 2, the second reason you may be exhausted is anemia. Anemia is one of the most common reasons we see for exhaustion. That's due to a lack of oxygen getting to our tissue. That's because red blood cells carry oxygen to our tissue, and when we don't have adequate amounts of red blood cells, we get an oxygen deficit, and that can cause a drowsiness. So you make sure to go to your doctor, have any necessary labs. You need those basic labs. You want to rule out anemia. Now, why a person can get anemia, sometimes it can be due to a poor diet. Women who, if you have a heavy menstrual cycle, you may be at risk for anemia. People who have trouble with digestion, maldigestion, celiac disease, IBD, irritable bowel diseases, are at risk of anemia. So after we look at sleep, if sleep is good, we want to look at conditions like we want to look at our blood work and make sure that we're not looking at anemia. Next to anemia, number 3, we look at malnutrition. If a person is not eating adequately, if they're not getting proper nutrition, if they're dealing with some kind of nutritional deficit, that also can lead to exhaustion, because you're not getting proper nutrition. Number 4 is a chronic infection. This is one of those things that I see a lot, particularly in people who suffer from chronic fatigue. We know there's a relationship between chronic fatigue and certain types of viruses like Epstein-Barr virus and also the cytomegaloviruses. So if a person has contracted a pretty serious virus and they haven't been able to shake that virus, that can certainly lead to chronic fatigue, what some people call adrenal fatigue, but I think adrenal fatigue is not really the best definition of this type of exhaustion. We're really looking at a body that is trying to rest, it's trying to reduce the amount of energy that we are expending, because that energy has to be redirected towards fighting that infection. So that is the story with chronic infection and chronic fatigue and why a person may be tired. Again, you really just want to talk to your doctor and find out what the source, the cause of the fatigue is. Going back to the issue of sleep, I also want to mention sleep apnea. That's a common condition where a person may be stop breathing during the night, or if this is a person, if you have a partner and they're snoring, and if you hear them sleeping deeply, maybe they stop breathing and then they begin snoring. Those can all be signs of sleep apnea. You may want to talk to your doctor about having a sleep study. But in the case of chronic disease, we're seeing with chronic infection, we're seeing that condition quite a lot with people who get these viruses like Epstein-Barr. Number 5, chronic disease states. Chronic disease states. Now, I've spoken about chronic disease. I probably am going to be covering the issue of chronic disease more in the future. But suffice to say that chronic diseases often will go undiagnosed because chronic disease is a slow process. The process of becoming sick happens so slowly that a person may choose to do nothing about it or ignore it until the symptoms are so severe that they have to seek medical attention. This is especially true in my patients who suffer from irritable bowel disease or irritable bowel syndrome, gas bloating, upset stomach, and they ignore it, and then the condition gets worse and worse and worse until they can't eat anything, and then they also will have other symptoms like depression and chronic fatigue. So common chronic disease conditions that are associated with fatigue can be the autoimmune conditions like lupus, rheumatoid arthritis, those sorts of conditions. Number 6, of course, we would be remiss if we didn't talk about thyroid health, particularly hypothyroidism. Those are conditions where metabolism can be affected because the function of the thyroid is to stimulate, is to help with metabolism. So if you suffer from hypothyroidism, you may feel sluggish, you may experience some brain fog. That's also true, by the way, with the autoimmune conditions. Just tired, brain fog, low energy. But in the case of hypothyroidism, you also may be experiencing with that resistant weight loss, where you're just not able to lose weight. And finally, number 7, stress. This is something I see particularly in major cities where people are working 2-3 jobs. They're trying to get some sleep. You'll see that symptom picture where the person is having trouble sleeping. And in addition to not being able to get some sleep, they're stressed out. And so their body is in a constant fight or flight mode. And so they never really are able to rest. And because they never are able to rest, they often remain in a constant state of exhaustion. So what are we going to do about it from a naturopathic perspective? Well, of course, you want to find the cause of the exhaustion, run the same labs that any other doctor would run. And you may also want to do additional testing depending upon where you suspect the problem is. One of the first things that most naturopathic doctors will go to is cleaning up the diet. making sure the person is getting adequate sleep, reducing caffeine, as I mentioned before, and alcohol 8 hours prior to bed. Make sure that mattress isn't lumpy. Make sure there's no pets or any other distractions in the room that could be having an impact on sleep. Making sure the room is completely dark, making sure it's not loud, and that's going to be disrupting sleep. Encouraging meditation prior to bed to encourage sleep. Improving a patient's diet if there is a problem with diet, and removing any foods that may be associated with food allergies. This is especially true if we're looking at a symptom picture of exhaustion and chronic disease. In that case, I will pull foods that are associated with sensitivities, allergies, and chronic disease. It's not unusual for me to put patients on what's called an anti-inflammatory diet, just because with the symptom picture of exhaustion, I will often see inflammation and chronic disease. All right, so those are just some quick ideas I have for you on natural ways we treat exhaustion. As I said, these ideas can be incorporated into your daily habits without interrupting any program that your doctor currently has you on. I want to thank you for watching this quick video on exhaustion and how I treat it from a naturopathic perspective. If you'd like to find out more about my work, you can go to drwhimsy.com. I'll link it below. I'm available here in my offices in West Hollywood, but I'm also available online through telemedicine and phone consultations if you need some general wellness coaching. Thanks for watching, and I look forward to speaking to you again soon. Take care. Bye-bye.